each and every one of you to another short feature from the specific self-care series for your body from Elite Healers Massage Therapy and me, Professor Adam. Today, I want to talk to you about back pain and tightness that come from a lack of movement while sitting down for long periods of time. I find this specific problem to be very common nowadays with all the sitting that happens in society. Sitting at a desk, sitting on a sofa, sitting in a car, sitting on a bike while getting exercise, or wherever else you may be sitting for long periods of time. Many of us, including you, are sitting down right now. And, I understand, but if you're feeling guilty, stand up as you watch the rest of this video. In my professional experience, when I've seen clients that come in to take care of lower back pain that's related from sitting for too long, usually they've tried other methods to take care of the pain. I'm like the second or third option, because when it comes to back pain that comes from sitting so long, they usually try simpler things like pain pills, foam rolling, walking it off. And I've even had people have come to me after a few weeks of going to a spa or someplace similar to take care of their lower back pain, but haven't had any luck with that lower back pain because all the person does is just kind of gently stroke over the lower back. Right? And I understand this frustration, and one of the things that I do is I do my best to help re-educate my clients on the proper fundamentals, and I also get them to think about which muscles they have to take care of for that. Their frustrations make a lot of sense to me. If I didn't know how the muscles work, then I would think that working directly on the lower back is the best solution, but it's really not. It's one part of the solution, and you need to do all parts to make it work. This is because muscles that are near and around the lower back affect the tightness in the lower back. Also, some of them are stacked on top of each other, and if you get the superficial ones, you're not going to get the deeper ones. So, what I want to do with this video is teach you the top 3 techniques that you probably haven't used up to this point in caring for your back pain. You haven't used these moves because I would say that you're most likely not familiar with caring with these 2 specific muscles that are related into lower back pain from sitting down for too many hours. In this video, what I'll do is I'll help you get to know those 2 muscles, and then I'll also teach you the best 3 self-care techniques for taking care of those muscles and helping them be mobile and flexible to help stop that back pain. Now, one other thing before I move on, if you can just take a second and click the like button down below if you enjoy the content that we've been bringing you and that we're continuing to bring you. The first technique we'll review is how to take a therapy ball and use it on the psoas muscle in your hips. The psoas is a deep hip flexor muscle that has its tightest attachments located on the vertebrae of the lumbar spine, while the lowest attachments are found on the inner aspect of the upper femur bone on the same side of the leg. The length of this muscle alone shows us that it will affect the lower back when it's tight, when it has trigger points in it, or when it's just chronically short, because it can get chronically short just from sitting down too much. Before I go any further on this one, please note that this is one of those self-massage techniques that's a little on the harder side to perform. So realize that it's okay just to follow along and not to try it. As for the rest of you, who I know are still up to trying it, my suggestion, as usual, is to make sure that you watch this technique all the way through, getting to know what I'm going to do and how I locate certain areas. And then once you understand it, feel free to try it along with me coaching you in the background as you do the technique. I'll even have it marked off with a visual image. If you need to fast forward it, you just scroll down and you'll see what time it starts and you go right to it. I'll make sure that it's in the description down below. If you feel this one is too hard for you to do, then you can always schedule an appointment with me or one of the other therapists over at the Elite Healers Massage Therapy Clinic, and we will take care of it with some manual therapy. You find us on elitehealers.com. And setup is very simple. Now, one other thing I want you to know before we start. When I work on this muscle, we're going to approach it on the anterior side of the body. We're going to work right near the border of the rectus abdominis muscle. And if you have a significant amount of belly fat in this region, it may be difficult for you to access this muscle. Also, if you have beer gut or the belly is just really big and it's really stretched out, then I want you to go see a doctor before you even try this and get their clearance. Also, if you're pregnant, skip this one altogether. This is a contraindication for you to do while you are pregnant. Wait until you have given birth, and then once you have given birth, please get doctor's clearance before doing this one. And once you have the doctor's clearance, feel free to follow along. Proper breathing on this one is also important. So we will be deep breathing, but we're going to be breathing deeply in a modified manner because we want to reduce the resistance when we let the ball sink into place. When breathing on this particular technique, we're going to breathe deeply from our lungs and partially only engage the diaphragmatic breathing because we want to prevent the area from below our belly button from expanding too far, because that would push the ball away from the target muscle. So to start this therapy ball technique, we have to find a comfortable spot on the floor and a tennis ball, a therapy ball, or a lacrosse ball. The tennis ball has the lowest amount of resistance, while therapy balls, they tend to be more of your mid-range resistance, and lacrosse balls have a lot of resistance, but not a lot of give, making them the toughest ones to use. Usually, you need that if you're very athletic, a bodybuilder, or you just like pain. The more the resistance the ball has, the more intense that technique will become. Also, I've learned that there's a ball that's even softer than the tennis ball. It's the same size, and it's easy to find. It's a doggy shoe tennis ball that you would get from a pet store. So it increases the level of intensity of possible balls that you can use from 3 options to 4 options, which is great for you beginners that either are just really sensitive in the region, you have many trigger points, or you have an overdeveloped psoas and you really don't need a lot of pressure or intensity to get to the muscle. Usually, this is what creates a very sensitive psoas, having it overdeveloped. So now, while you're on your soft surface, I want you to find your belly button, go about 5 inches laterally to the side, and then 3 inches down inferiorly. Now, you're going to place the ball over that region. So you keep it there with your hand until you lower your body onto it, and don't let it move. Then you lower your body onto that therapy ball, maybe a little more gracefully than I just did, and you're going to let it sink in and breathe. From here, you can also, if you need another method, move slowly up and down, only about 1 inch or 2, using your toes to create that effect, creating a little stripping effect on your psoas. Or you come up, this would be your normal resting position. I'm already in what is called a Sphinx position, just to be able to talk to you so you can hear my voice. But you come into the Sphinx position and you breathe. So you take the ball, just to review, you find that location, you rotate down, you place pressure, then you get into your resting position with your hands on your forehead. You hold this position and you breathe. If this is enough, you can do this one just alone. If you want to do a little bit more, up and down with the toes, a little slower than what I was just doing, just to kind of create that stripping effect on it. Or you come up, bring those elbows into your chest, and just hold and breathe in the Sphinx position. And that is how you use a therapy ball to your psoas muscle. Welcome back. We now learn how to stretch the hip flexor that attaches to your lumbar spine. There are 3 hip flexors, only one does that. It is a muscle that is called your psoas muscle. While it is categorized as a hip flexor muscle, psoas can be the muscle that is responsible for your back pain and is oftentimes not looked at when treating back pain. This happens, it gets tight and it shortens. When you get out of your seat, if it doesn't cause you to bend forward, it's going to pull on your lumbar spine, creating tightness and limitations. Over time, this can affect other muscles too, since they have to compensate for this now chronically tightened psoas. leading to new tightness and dysfunction in muscles near and related to it. The name of the stretch we're going to learn is called the kneeling psoas stretch. So, to start this stretch, have your soft surface, put one leg back, get the knee down on the ground, and make contact with the floor. Dorsiflexing your toes at the ankle joint, meaning pointing those toes up towards you. Now, one thing I want you to do is to make sure that your knee is in alignment with your hip for a starting position, and that your knee is also in alignment with your heel. Now, you'll take the other foot, make sure it's in front of you. You're going to put your heel down and make sure it's in alignment with your knee, and then you're going to make sure your knee is in alignment with your hip. This should put you in a position where both your knees are close to 90 degrees of flexing. Now, from this position, what I'm going to have you do to engage the stretch, to start the stretch, is I'm going to have you contract both your gluteal muscles, but at the same time, while contracting your gluteal muscles, I want you to take your tailbone and tuck it in and hold and breathe. So contract, tuck the tailbone in, hold and breathe. This will cause a stretching feeling on the front side of the leg, on the knee that is touching the ground. From here, you hold and breathe. If you want to increase the intensity of that stretch, you'll take your belly button and rotate it away from the leg that you are not stretching. You will rotate it towards the side that you're stretching. Hold and breathe. This might sound counterintuitive, but the psoas on one side attaches to the lumbar vertebrae, and on the other side attaches to the inner part of your femur. So by rotating away, you lengthen the muscle just a few millimeters to a few centimeters. But sometimes that little extra intensity is all you really need to get deep into the muscle. Then, when you're done, rotate back, release the glutes, unlock the position. Then you can go and you can switch legs and do the same thing on the other side. We'll go through it real quick. Make sure those toes on the side that you are stretching are making contact with the ground, firmly pointing it up towards you. Make sure the heel is in alignment with the knee on the side you are stretching, and then that the knee is in alignment with the hip. Then on the other side that you are not stretching, make sure that the heel is down on the ground, direct alignment with the knee, and alignment with the hip again. Now, to engage that stretch, contract the glutes, tuck the tailbone in, and breathe. We're going to hold and breathe, practice that deep breathing, and after 30 seconds you can release, or you rotate towards the side that you are stretching to just increase the intensity, hold, then when you're done, you breathe, you come out of it, you get out of that single kneeling stance, and you are done. And that is how you stretch your hip flexor muscle. Thank you for watching. The next stretch I will go over is for a lesser known back muscle, which is known as the quadratus laborum, aka the QL. The QL, let's talk about it. It's found deep below your lats and the lower back fascia, and it's just superficial to your kidneys. What does this mean? This means that you should be careful about any form of self-massage to this very deep muscle. In my professional opinion, the untrained person has more harm potentially than risk if they try to do it. So what does that mean? That means I will not be teaching that technique. If you really think you need it, and you need a professional massage therapist to work on your QL, then schedule an appointment at healersmassagetherapy.com and book with myself or a different therapist, and we can safely treat your muscle with some manual therapy, because the most important thing is that you're safe. Now, a little more about the QL. It extends the lower back at the lumbar spine, and it also does lateral flexing to your side. It gets tight as you sit down for long periods of time and starts to become dysfunctional. What we'll do is we're going to stretch it out, not only in one direction, but we're going to stretch it out against both the actions it does, so that way we can really isolate the muscle and get a good stretch on it. To give you an idea of what the QL looks like, it's a square-like muscle with the highest point being at the last rib, and then it goes down parallel to the lumbar spine, and then finally connects over the hips posterior ilium bone. Anyway, let's get ready to stretch in a move that I call the QL and LD modified child stretch. We're going to start this stretch by getting onto our soft surface. Then we'll get on all fours and then sit back in our heels. This will result in a position where your hands are over your head, like that. Now, for some people, I'll teach you, if you can't do this, I'll teach you what to do. Because this gets your QL, your lats, and your spinal erectors. But we're going to get a little more emphasis on them by putting our hands opposite to the side we're going to stretch. So then down towards the ground like this. Hold and breathe. But if you want to take your lats out of the picture, let's say your lats are really tight, or you have that dysfunction where you just can't get your hands up over your head, then what I'm going to have you do is you're going to put your hands over your forehead, and you're going to do this instead of reach out in front of you. You're going to take your hands, you're going to sink into that stretch, and you're going to hold, and you're going to breathe. Try to get the elbow going away from the hip on that side that you are stretching, and hold and breathe. Then you come out of it, you can switch, you can do the same thing. Hands on your head if you want to take the lats out of the picture or you have shoulder dysfunction. Come down into that stretch, hold and breathe. And just hold. Then after 30 seconds or so, you come out of it, and then you are done with stretching out your QL.